The pH scale is used to determine whether a substance is acidic or basic, and to calculate how strong a chemical it is. A pH value is a number that ranges from 1 to 14 for most common chemicals, with 7 being the middle or neutral point. Values below 7 are indicators of acidity, which intensifies as the number decreases, while values above 7 indicate alkalinity, which intensifies as the value increases. Notably, the pH scale is not a linear scale, meaning that an acid with a pH of 3 is not twice as strong as an acid with a pH of 6. Instead, the pH scale is a logarithmic scale. A substance with a pH of 3 is 10 times more acidic than a substance with a pH of 4, and 100 times more acidic than a substance with a pH of 5. Similarly, a substance with a pH of 9 is 10 times more alkaline than a substance with a pH of 8, and 1,000 times more alkaline than a substance with a pH of 6. The concept of pH was first introduced by a chemist named Søren Peter Lauritz, who worked at the Carlsberg Laboratory in Copenhagen. The H represents the hydrogen ion concentration, upon which the entire concept revolves, but the exact meaning of the P is highly disputed. The scale basically measures a potential difference between different solutions by counting the negative power of 10. Both of these words, power and potential, start with P in all three languages, French, German, and Danish, that Sorensen spoke. Theoretically speaking, the pH scale should range from negative infinity to positive infinity. This claim is according to its definition, which states the pH of a substance is the value defined by the negative logarithm of the hydrogen ion concentration. However, in reality, most solutions you would find in a standard laboratory have a pH value between 0 and 14, because in order to reach pH levels below 0 or above 14, one would require extraordinarily acidic or basic solutions. Achieving a negative pH rating is definitely possible. In practice, any acid that yields a concentration of hydrogen ions with molarity greater than 1 will show a negative pH when calculated, but we cannot measure it with any known instrument. Litmus paper only indicates whether the pH value is above or below 7. As such, pH meters are necessary to establish the actual value. However, even glass electrode pH meters fail in such extreme tasks because of something called acid error, which causes even these highly advanced devices to measure a pH that is higher than the true value. In conclusion, it is indeed possible to have a pH outside the conventional 0 to 14 range. However, in such cases, pH fails to be a useful or even meaningful measure due to the various limitations caused by the instruments and the solution itself. From a simple perspective, what pH does is translate extremely small hydrogen ion concentrations to a more familiar range of numbers, but as the concentrations become larger, this practice loses its value. Hopefully, there will be future modifications to improve the efficiency and accuracy of our extreme measurements. After all, pH is one of the most famous and useful concepts in the world of chemistry, and in the realm of science, accuracy is essential.
Importance of pH in everyday life. Living organisms can survive only in a narrow range of pH change. The human body works within the pH range of 7.0 to 7.8. When the pH of rainwater is less than 5.6, it is called acid rain. When acid rain flows into the rivers, it lowers the pH of the river water, and the survival of aquatic life in such rivers becomes difficult. Plants require a specific pH range for their healthy growth. In terms of humans, it's very interesting to note that the stomach of a human body produces hydrochloric acid. It helps in the digestion of food without harming the stomach. During indigestion, the stomach produces too much acid, and this causes pain and irritation. To get rid of this pain, people use bases called antacids. These antacids neutralize the excess acid. Magnesium hydroxide, which is also called milk of magnesia, a mild base, is often used for this purpose. Tooth decay starts when the pH of the mouth is lower than 5.5. Tooth enamel, made up of calcium phosphate, is the hardest substance in the body. It does not dissolve in water, but is corroded when the pH of the mouth is below 5.5. Bacteria present in the mouth produce acids by degradation of sugar and food particles remaining in the mouth after eating. The best way to prevent this is to clean the mouth after eating food. Using toothpaste, which are generally basic, for cleaning the teeth can neutralize the excess acid and prevent tooth decay. In the outside world, there are many other places that the human body encounters acid. For example, bee stings leave an acid that causes pain and irritation. Use of a mild base like baking soda on the stung area gives relief. Stinging hair of nettle leaves inject methanoic acid, causing burning pain. Some more of the naturally occurring acids are vinegar, which is acetic acid, orange, which is citric acid, tamarind, which is tartanic acid, tomato, which is oxalic acid, sour milk or curd, which is lactic acid, lemon, which is also citric acid, ant sting, which is methanoic acid.
Jasper, and I'm back again filming for Wish Trend. So the weather here in Korea has been really chilly lately. It's starting to get a lot colder, and Korea has 4 seasons, and now we're kind of in the stage of fall to winter. And during this time, your skin's water-oil balance starts to kind of, mess up, and your skin gets really dry. It starts to feel like it's losing its elasticity, and you need to really, really take care of your skin. Not only does this occur due to the weather, but it could also occur because of your lifestyle and other, external factors. So if you feel like your skin is getting a lot drier and it's starting to act out and get breakouts, then please keep watching. So, for healthy skin, it's really, really important to get the perfect water-oil balance. Now, if you say this in a different way, this means getting a good pH balance. What does a pH balance mean? pH balance is basically the acidity or the alkalineness, does that even make sense? But yeah, the acidity and alkalineness of your skin or water. So pH levels range from 1 to 14, and if it's a 7, it's neutral. And if it's lower than 7, it's acidic, and if it's higher than 7, it's alkaline. The healthy skin pH level is known to be 5.5, so it's slightly acidic. Having a healthy pH level and skin balance means that your skin is able to protect itself and have a strong skin barrier. This means if this balance is broken, then your skin is going to start to act up and react. When your pH starts to lower and lessen and become more acidic, this means your skin is going to produce excess sebum and oil glands start to just spur out oil, making your skin feel oily and greasy. When your skin is more acidic, the keratin that protects your skin can start to not work well and make your skin feel really rough and lose its elasticity. On the other hand, if your skin gets more alkaline, then it starts to not produce enough oil and sebum for your skin. This means your skin will start to break out and be more sensitive and dry. Because of this, to maintain healthy skin, you need to make sure you're not way too acidic or way too alkaline, but just right. Now, a question.
So someone had a question recently related to the pH of saliva. And they're very concerned about their pH being too acid or too alkaline, and they wanted to know, what should it be? Well, this is the normal pH range of your saliva, between 6.2 to 7.6. And anything above 7 goes alkaline. Anything below 7 is acid, 7 being neutral. So your saliva could be slightly acidic, could be slightly basic or alkaline. So it can be both. Now, if your saliva goes too high, potentially you could start developing tartar. If it's too low and you become too acidic, you could start developing dental cavities, as well as infections in the gum and bad breath. And there's a whole bunch of other problems that you could develop. Well, you have to realize that in your mouth, you have a lot of bacteria that use dietary sugar to make acids. And that's what really breaks down the tooth. Now, if you're on the ketogenic diet, you could be very, very acidic, because the definition of keto is just low carb. So you could just do a lot of fat and protein and get into ketosis and end up becoming pretty acidic. Now, the type of keto that I recommend is healthy keto, which my definition is providing all the nutrients that you need and balancing out your protein and fat with vegetable a lot of it, between at least 7 cups up to 10 cups per day. Now, of course, that would be more salad. I'm not talking about 10 cups of broccoli, for example. There's no way you're going to do that. Maybe you do 4 cups per day. But when you're talking about salad, you have big salads. That provides a lot of alkalinity to help balance off these acids. So you have a lot of potassium, magnesium, and also calcium. So that way you provide all the nutrients to help buffer any type of foods that could create excessive amounts of acids. Now, if someone has candida, okay, in the mouth, they're going to develop excessive amounts of ammonia. And ammonia is very alkaline. So that can really throw off your entire pH from this infection right here. And also, if someone is under chronic stress, they tend to become excessively alkaline, which is interesting. But the real problem is, when you talk about pH, what fluid of the body are you talking about? Are you talking about the blood, which is slightly alkaline? Are you talking about the large intestine, which is acid? Or what about the gallbladder and its fluid, which is alkaline? Or the stomach, which is extremely acid? So it's very important to define what fluid you're talking about if you're too alkaline or too acid. The problem is trying to diagnose someone from having either an acid saliva or an alkaline saliva is pretty much a waste of time, because what's going on in the saliva is really happening systemically. Even from your urine, what's happening in the urine is happening more internally. One of the problems with testing the pH of your blood is as soon as you inject the person and take the blood out, it quickly oxidizes and it alters the pH. So it's very difficult to determine the pH of your blood unless you have some fancy equipment. And I know typically that there's this idea floating around that everyone needs to be alkaline, and so start drinking alkaline water and a lot of your problems are going to be cleared out, and cancer is acid, so if you stay alkaline, you're going to be safe. That is false information. When some people start drinking alkaline water, for example, because they bought this machine, I've tested the urine on some of these people, and their urine is even at a pH of 9, which is incredibly, incredibly alkaline. Typically, the urine should be between 5, maybe 6. When you have a pH of 9, that is so far off the scale that that's going to set you up for a lot of problems, because one of the reasons why you want your pH in the urine to be acidic is to prevent bacterial growth. So this is not going to do it right here. So the bottom line is, I wouldn't try to correct a pH problem by either taking something that's more acid or taking something that is more alkaline. I would do it by implementing a healthy diet. I would try to focus on
When your stomach is working normally, you probably don't think about it at all. But when it starts acting up, you can't ignore it. And right now, it's definitely speaking to you. Because all of a sudden, you have no stomach acid. Why could it lead to infection? How powerful is stomach acid? And would you excrete food whole? This is What If, and here's what would happen if your stomach acid disappeared. Your stomach is powerful, and of all the digestive juices it produces, hydrochloric acid is the most extreme. This liquid form of hydrogen chloride is also used in fertilizers, fireworks, rubber, and steel. If you inhale it, you could suffer from nose and breathing issues. But this dangerous acid is essential for your well-being, and without it, you'd be in big trouble. You chew and swallow your food, it becomes what's called a bolus. This travels down your esophagus and into your stomach, where it gets mixed with the gastric juices. As I mentioned before, this mixture is potent, but luckily, You have a protective shield made of epithelial cells in the lining of your stomach. Without epithelial cells, the gastric acid would eat away at your stomach lining. As extreme as stomach acid is, it does 4 important things for your body. First, it breaks down protein. This is called proteolysis. Second, it activates pepsin, which helps you digest the protein. Third, it kills any harmful bacteria that hitched a ride on your food. And finally, your stomach acid sends a chemical signal that moves the food into your small intestine. After the food moves through your small intestine, it goes into your large intestine. And then, well, you know what happens next. Not having enough stomach acid, or hyperchlorhydria, is a common health issue. In the United States, 22% of the population suffers from it. Age, stress, processed foods, and overusing antacid can all cause problems for your stomach. The good thing is that you can always eat some ginger, fermented vegetables, or drink some apple cider vinegar. They can reduce inflammation, break down food, and increase stomach acid, giving you a happier digestive system. It's easy to take your body for granted, but it works hard, and we should all treat it like the beautifully complex instrument it is. Taking care of your body could be as simple as going to the bathroom as soon as you feel the urge, even if you're on a long road trip.
Greetings, Eric Backer, naturopath from New Zealand. Question today, my stool pH is low. What does this mean? Is it too acidic? Is it candida? What is it? So let's have a look at stool pH. So we often get stool test results back. I got one here back from a patient, for example. We'll just cover over the patient's name. So this is a typical stool test here. In fact, this patient here, interestingly, has, look at that, Candida kefir, from having too much kefir in the diet. So kefir can also create a Candida problem, so watch out. So this patient's stool pH is too low. It's 5.6, I think. We'll explain exactly what that means in a minute. Yeah, so this patient's stool pH, you can see here, is 5.7, okay? So we're just dealing with where are we? We're dealing with this number over here. So the stool pH ideally should be, I think, around 6 to about 7.8 is about the average stool pH. So when the stool pH is too low, it usually means a problem, and when it's too high, it means a problem. So low will mean too acidic, of course, and too high will mean too alkaline. So beneficial bacteria in your digestive system, particularly the bifidus species and the lactobacillus species, they generate a lot of these acids called short-chain fatty acids. And these really help to ferment different fibers, undigested fibers in the colon, and this will actually start adjusting the pH of the bowel. So if you've got a rapid transit time, like if the stool passes through too quick, the pH will be too low. If you've got constipation, it can be a little bit too high. Antibiotic use, for example, or killing off a lot of bacteria in the bowel, good bacteria, will elevate the pH of the stool. Candida can be associated with low pH or high pH, depending really on the types of beneficial bacteria that you've got in the bowel, and also whether there are parasites there or other kinds of bacteria, like Citrobacter, for example, or Pseudomonas. If these guys are way too high, that's going to throw the pH out as well. People with poor stomach or pancreatic function can also have problems with their pH because they're not digesting foods properly, which means they're not going to really get a proper fermentation in the colon, which in the large bowel, which will affect the pH of the stool again. So when the pH of the stool is way too low or way too high, it can also push you more towards inflammatory diseases of the bowel and even cancer. So it's important to keep the pH between 6 to about 7.8. Foods do influence the pH of the stool to a degree too, but more so chewing and stress. And good food selection is very important. Having a can of Coke and chicken McNuggets is not going to give you a really good stool pH, is it? So having a hamburger and a cigarette and a cold beer is probably going to cause problems with your tummy if you keep eating like that long term. Eating broccoli and maybe some lean chicken or some salmon is a more sensible choice, because you've got better foods there in terms of the fermentation capability, which means you're going to have a much better bowel function. Food is medicine. Medicine is food. Think about it. So I hope that answers the question a little bit about stool pH. It's governed very much by what you eat and how you eat. And candida certainly can be influenced to a high degree by pH as well, because having a good stool pH is going to discourage the growth of candida in the digestive tract and encourage the proliferation of beneficial bacteria. Thanks for tuning in.
Hello friends, today's topic is about what is alkaline diet. Also we will look what is the correlation of diet and our urine pH. So normally urine pH that is ranging from 4.5 to 7.45. So it is generally acidic in nature. So urine pH generally acidic. But diet rich in vegetables, then in vegetables this organic acid is present like citrate and tartrate. And so due to presence of this organic acid, they are converted into the bicarbonate, and so that urine become alkaline in nature. Further, in relation to the diet, you have to remember when diet rich in protein, then more of sulfuric and phosphoric acid will be generated, and due to that urine become acidic. But opposite to that, what high pH means towards the alkaline side, this pH of urine is observed when low protein diet is taken. So high protein diet, that urine become acidic. Low protein diet, urine become towards the alkaline side. But after meal, generally what is observed? After taking of meal, our stomach will secrete acid. That particular HCl, hydrochloric acid, is secreted, and during that time bicarbonate level will increase in the plasma, and due to bicarbonate level increase in the plasma, urine have the high pH, and this high pH in the urine after taking of meal, that is called alkaline diet.
The blood system of an adult person contains about 5 liters of blood, a liquid that carries nutrients and oxygen to all living cells in the organism and removes waste products. One of the most important functions of blood is to provide oxygen for cell metabolism and remove the waste product, carbon dioxide. This process is quite complex, and its effectiveness is strongly affected by the pH of the reaction medium. Therefore, the pH of blood plasma is carefully controlled by the organism and maintained at a constant level of 7.4. The pH inside the erythrocytes is a little lower, about 7.25. Effective control of the pH is possible because blood contains a certain amount of carbonic acid, which is a weak diprotic acid, and also a certain amount of its conjugate base, the bicarbonate ion. The delicate balance between the concentrations of these two species allows the pH of blood plasma and erythrocytes to be maintained at a constant level. Solutions containing weak acids and their conjugate bases are capable of maintaining their pH at a certain stable value. Such solutions are called buffer solutions.
Although about 50% of the population is in possession of a vagina, because we never talk about them, most of you are still wandering around every single day wondering if something your vagina does is totally normal or really strange. I'm Mama Dr. Jones, a board-certified OBGYN and mom to 4, and today I'm telling you 5 things your vagina might do that sound strange, but are 100% normal. If you're new here and you learned something from this video, please consider subscribing and turning on that notification bell so you never miss an upload. Let's jump in to the vaginal information. Number 1, makes discharge. That's right, vaginal discharge is 100% normal. Your body makes vaginal discharge to keep itself clean and healthy. Did you hear that? This is how the vagina keeps itself clean. It's a self-cleaning organ. Please don't put any soaps or douches or anything like that inside. These can disrupt the vaginal microbiome and actually cause more problems than they help. Normal vaginal discharge is a mixture of cervical mucus, transudate or fluid from the cells of the vagina, kind of like saliva in your mouth, normal flora and dead cells that your body needs to get rid of. It's completely normal and your body likes it to be there. I recently made a video all about when vaginal discharge might be abnormal, and I will link that in the description box below if you have any additional questions. But in general, vaginal discharge is a normal part of a healthy, happy vagina. Number 2, mixed discharge that might bleach your undies. This is something I have seen all over TikTok. Some people get it right, some people get it wrong, but I am here to tell you that vaginal discharge, which discolors your dark underwear, is totally normal.
If you don't have a vagina, you're gonna be very confused by what I'm about to say, but is no one else completely terrified by the bleaching properties of a vagina? Like, how does she do that? Yes, I'm about to show my underwear on the internet, and that's because I am comfortable with who I am as a person. Prefacing this by saying these are clean underwear. Like, these are black underwear. Ba-bam. How? Pink. How? How does she do that? Like, what?
Why does this happen? The vaginal epithelium is lined with cells that make glycogen, and this is because glycogen creates a happy home for a bacteria called lactobacilli. Lactobacilli is a normal part of your healthy vaginal flora, and it converts glucose into lactic acid. Lactic acid has a low pH, so the environment of the vagina is acidic. That means your vaginal discharge is also acidic. Over time, that acidic vaginal discharge can lighten dark fabrics in your underwear. No matter what TikTok told you, this is totally normal. It's representative of a happy, healthy vagina.
Editing MDJ here. I wanted to add in here that I said that this is okay and it's part of a normal, happy, healthy vagina because it's related to the pH, and that is definitely true, but that doesn't mean if it doesn't happen to you that there's something wrong or your pH is off. It can be normal either way. So in the absence of other symptoms, this is a normal thing that can happen, but not a requirement to happen.
In the context of higher organisms such as mammals, semen is defined as the viscous biological fluid produced from the reproductive organ of reproductively mature male members of a species during the act of ejaculation, which take a strip of either broad range or narrow range pH paper and touch one surface onto the semen sample. Observe the pH paper for color change. A more accurate laboratory pH meter can also be used to determine the pH. Normal semen has a slightly alkaline pH ranging from approximately 7.2 to 8. Acidic semen could be indicative of a blockage in one or both seminal vesicles. High alkaline pH could be a result of infection.
Hi everyone, John Osipinski here. Hopefully you're having a great day. Today I'm going to talk about colic in infants. One of the reasons that we don't look at is that the breast milk, if you're breastfeeding, is sour. And this has to do with acid-alkaline balance. If the mom's body is acidic, then the breast milk that she's producing is overly acidic. And the baby is now drinking acid, and it can actually manifest as stomach problems and gas and bloating. I've seen this 3 or 4 times in the last decade. The first time was when I was at my daughter's dance class. She was maybe 5 or 6 years old, and one of the mothers there had a little 10-month-old infant who mentioned was going for surgery, going to be scoped. And I asked her what was wrong, and I happened to mention acid, and the woman said, "I'm surprised you mentioned acid. My breast milk tastes sour." And when I asked the woman to test her pH, she came to my office, she was severely acidic.